Natasha Sherrill, family nurse practitioner. I have our questions for the week. These are questions that I have been asked either in clinic or messages that have been sent to me. All right, so let's dive in. All right, first question. Is there anything I can do for turkey neck that isn't surgical? And yes, there are things that we can do here at New Age that don't involve surgery to help with some skin laxity underneath the neck. Maybe you're noticing a little more tissue. And the treatment can vary based off of what is causing the symptoms. So if we are seeing some heaviness in the neck, if that is happening from volume loss, sometimes adding in some volume and some support to our lateral, medial cheeks, and maybe even to the jawline can help with the turkey neck. So another option would be placing neuromodulators such as Botox, Dysport, Daxxify in the bands in our neck or in the muscles in our neck. These muscles are called our platysma. The platysma or our platysmal bands, you'll see them. Mine are kind of hard to see because I'm nice and toxed up right now. But when you engage these, you kind of get these pulling. You'll see these, they look like literal bands that come down. They originate right around here, the jawline, and they come all the way down. They are depressors. And so what that means is that they are pulling our tissue, pulling everything down. When you can tox those or place a neuromodulator, when we relax those muscles, they're not able to pull as much. And when they're not pulling, we do see everything get repositioned in the area that it should be. And so that's a really great option. If you haven't tried neuromodulator in the neck, it really is a game changer. Talk to your injector about it. It's a great treatment and the results are really phenomenal. I've had patients where when we treat the neck, not only do we see an improvement in the jawline, but even in their cheeks, they'll notice an improvement because these muscles aren't pulling everything. And when everything's not being pulled down, it gets repositioned. So you'll see an improvement sometimes even in this area when we treat the neck. All right, another question that we get is, how do I treat like jowling, heaviness in this area or wrinkles without having to do an injectable? In this area, we can see some heaviness here. Typically, we're losing volume in our face, our fat pads are separating, our bone structure is changing, we're losing collagen. And when we do that, right, everything kind of falls forward and down. And so we notice a lot of heaviness in this area. And to support that, if you don't want to do an injectable, microneedling, really RF, radio frequency microneedling, can work wonders for this. The radio frequency microneedling will work because we are penetrating deep into the dermis, and when we're penetrating into the dermis, we're also adding some heat or that radio frequency. So we're stimulating collagen deeper and then also a little superficially as well. So when you are creating more collagen, you're adding more support, the tissue will be supported better. And when we're stimulating that collagen, we are able to improve the skin texture, the skin quality, and improve skin laxity. And with that, you can see an improvement in this area underneath the neck as well with the radio frequency microneedling. And so for wrinkles, if we don't want to do an injectable, I love to do laser treatments for that and medical grade skincare. The lasers will help stimulate collagen, and with that, you'll see an improvement in the lines at rest. They're great because they don't have a lot of downtime. Pain-wise, it's very tolerable for most patients, and they're fairly affordable. Question number 3. So I get darkness, hollowness underneath my eyes. Is there anything I can do to treat that, or is it just genetics or lack of sleep that's causing it? Hollowness or darkness underneath the eyes can be caused by a pretty wide range of conditions. It could be genetic, it could be lack of sleep. Sometimes people have allergies. We can see darkness underneath or like that little ring. So that could be causing it, but also it could be our skin is getting thinner, our tissue is repositioning, and when we have things like that going on, we notice some of these symptoms. So treatment of darkness underneath the eyes or hollowness will vary based off of what's causing it. So if we are seeing darkness due to tissue being really thin, we can do like eye brightening serum that can help support. We also can do some collagen stimulation. We could do some RF microneedling. Now you can't do the microneedling all the way up, but we are able to, pull this tissue down and do some microneedling on the bone here in this area. So that can help support. Under eye PRF EZ Gel, I think, is wonderful for this area. PRF EZ Gel is great underneath the eyes because it absorbs really well into the tissue, because it's your own growth factors. It doesn't need to be dissolved. It looks so natural. It's such beautiful results. And when we usually are able to yield more than what we need just to place underneath the eyes. So it's great for whatever extra we have left. I love to place it in areas that need a little extra support. So lateral cheek, medial cheek. If we need anything in the lower face, EZ Gel will be great there too, because it's going to help stimulate collagen. Sometimes we are seeing hollowness underneath the eyes or darkening of the pigment because we are losing volume in this area. And a lot of times, actually, patients will come to me with the concern of under eyes looking tired and fatigued. And depending on the patient, I'll actually start with treating other areas of the face before I do the under eyes. And a lot of times, I actually don't even need to treat the under eyes if I add support back and volume to other areas of the face. Because when you add support back to this cheek portion, it's pretty amazing how much the under eyes improve with some volume in that area. So it is rare for someone to come in and see me of complaints of under eyes, and that's the only area I treat, because there's usually something else going on that's causing the hollowness or the darkness. So I think it's great to look at the face globally and just really assess everything that's going on and take that into consideration before you're treating just one area. Okay, question number 4. So it's wintertime here in Alaska, and patients want to know, what's the best treatment to get this time of year? I love to start laser hair removal packages during the winter time. It's important during those series that we are limiting or really having no sun exposure, because we don't want to treat the area when your skin is tanned, either from sun exposure or from even a spray tan. So those are good ones to start. I love also pulling pigment. So if we have sun damage that we need to treat, treating that sun damage this time of year is great because we don't have as much sun exposure. Chemical peels are also really good to do this time of year. If you're concerned with dullness, dry skin, doing a dermaplane right now is also great to do. We're removing that dead skin, that little bit of like peach fuzz that we get on our face. Taking all of that off will make sure that the treatments that you're receiving or the products that you're using are really being able to penetrate into the skin. And honestly, wintertime I think is great to do the more aggressive treatments like RF microneedling, because a lot of times we aren't going out and doing as much. So if we have more downtime with treatments, typically this is the time of year when we're able to complete those. So one question we got was, are there bears walking around in Anchorage? Yes, actually, not so much, downtown, but in like neighborhoods, it's not uncommon to have bear sightings. We have trash cans actually that have special locks so that bears can't get into them. I have not seen one in my neighborhood, but I've seen many signs saying there have been bear sightings. So, certain times of the year, usually like spring when they come out of hibernation, and into the fall when they're getting ready, they're kind of stocking up. You have to be a little more cautious when you're going out for like hikes. We always carry bear spray with us, things like that. But yeah, you can absolutely see a bear in a neighborhood, which is actually really crazy. Another question people have is the darkness up here. In the winter, do we actually get to see the sun, and how much? So in the winter in the sun, it is absolutely decreased. I think the shortest day is like 4 hours of daylight, and from middle of June all the way up until middle of December, we're constantly losing a few minutes every single day of sunlight. And then vice versa from December up until June, we're gaining a few minutes every single day. So in December, it does get, you know, a little difficult to be up here because of the darkness. It is just very important. I tell my patients all the time, you got to get outside, even if the sun's not, you know, completely out. Getting some fresh air can absolutely help with energy and mood levels. Happy lamps are absolutely a thing that we will hook up, and just to get some vitamin D and get a little something during the daytime. You'll see that at patients, or you'll see that at people's desks or in their homes. Okay, well, that's all I have for you guys today. Thank you so much for listening. If you have any other questions, please shoot us a message. I'd love to answer them for you. Have a good week.